Good morning and welcome to this special GMC COVID-19 webinar. I'm David Lubar, Chair of the GMC and President and CEO of Lubar and Company. This meeting is a follow-up to the April 13th GMC meeting, and we are most honored and pleased to welcome back Governor Tony Evers and WEDC Secretary and CEO Missy Hughes. Governor Evers recently announced the Badger
I'm in. Thanks, Rich. Bye-bye.
Governor Evers recently announced the Badger Bounce Back Plan. This is Wisconsin's plan to reopen Wisconsin by balancing progress in the healthcare considerations with the need to restart our state's economy and getting businesses reopened and people back to work. Following Governor Evers and Secretary Hughes, we will hear from Dr. John Raymond on a healthcare status update, and then from several local leaders about how they are dealing with COVID-19 from the business perspective, from education, and from philanthropic perspective. Like our last webinar, all attendees are muted and your video screens are off. You have access to the Q&A box to submit questions. As we have a full agenda, presenters may or may not have time to answer all your questions. Again, the chat box will not be open. I would now like to proceed and introduce Governor Evers and Secretary Hughes. Governor?
Thanks so much, David, and thank you to the Greater Milwaukee Committee for inviting me to speak and also your support throughout this whole process. I understand we're all in this together, and the Greater Milwaukee Committee has been doing that. So obviously it's a difficult time for everybody in Wisconsin. The COVID-19 pandemic has strained our state and created a huge tidal wave that's impacted all our communities. Obviously, we continue to mourn the loss of every person to COVID-19, whether it's fathers and mothers, brothers and sisters, and neighbors, co-workers. We're continuing to see generally positive trends in terms of our COVID-19 caseloads as we flatten the curve. However, we still need more testing, contact tracing, and then always PPE issue still is a problem. But our updated Safer at Home order reflects these positive trends, which has allowed us to reopen more retail businesses using drive-through services, of course, golf courses and other activities. It's important to remember, first and foremost, that this is a health crisis, and Dr. Raymond will advocate for that position too, I'm sure. We're dealing with a virus that can be spread by people who don't know they're sick and have no symptoms. So it's one of the most dangerous. So one of the most dangerous things about this virus is the appearance that all is well and the danger that we're lulled into complacency and desire to get back to normal. It's important to understand that from an economic standpoint as well. The absolute worst thing we can do is resume operations without the appropriate groundwork and then experience another round of infections and illnesses, potentially one that could be worse than this one, if that's possible, but it is. That would be bad for public health, bad for our economy. We need workers and consumers to have confidence that they can operate safely. So those principles guide both the Badger Bounce Back and WEDC's Wisconsin Ready program. Both are aimed at providing a roadmap for businesses and residents to continue moving forward in a way that protects businesses, workers, customers, and the community at large. The Badger Bounce Back provides benchmarks for a state so that we have a better idea who's sick and who's not, where the disease is progressing and where it's abating, and what medical resources are available in each community. It's a data-driven approach to keeping people safe. Now, there have been a lot of questions about, setting a date for when businesses will reopen. The good news is that, especially as compared to some of our neighboring states, Wisconsin has a significant number of businesses that have reopened and many more that never closed in the first place. There are tens of thousands of people in Wisconsin working every day. We know that people continue to do essential activities like grocery shopping and picking up medicine. We've opened up activities like golf, expanding curbside pickup for many retailers, and continue to evaluate the way that businesses can operate safely. Had many discussions with business owners and business leaders around the state, as well as many working folks. And we will keep these conversations going as we continue to turn that dial. We have to be patient. I know that's tough on workers, businesses, and consumers alike. Everyone depends on a thriving economy, but I have faith in Wisconsinites, and I know we will get there if we continue to flatten the curve and we continue to develop the testing and get the equipment we need in order to have a start on the road back. So we still have a lot of work ahead of ourselves. As always, will continue to lean on the Greater Milwaukee Committee for help and guidance in carrying out our mission together. And just thank you so much for inviting both Missy and I today. And I'll turn it back over either to David or Missy, one of the two. So thank you so much.
Thank you, Governor. I think we're going to turn it right over to Missy. So Missy, would you be willing to give us your thoughts? And thank you again very much, Governor Evers.
Thank you.
Okay. Okay, good.
Hi, everybody. Thanks so much for having me here today. Thank you, Governor. You know, it's amazing how much work the governor is doing to get out and communicate. I think it's just really important to be communicating with folks like GMC right now, because you can help us carry our communications forward. And what's really important is that we're all working together and communicating with each other. So as the governor mentioned, WEDC is hand in hand with DHS and the governor's office on Badger Bounce Back and what our part of it that we're calling Wisconsin Ready. So if I can, I'd like to just walk you through the three main parts of Wisconsin Ready so that we're all on the same page. The first is this effort to get businesses ready. So, you know, if you think about it, we're in this moment of pause where we have, as the governor mentioned, a lot of essential businesses running, and we need to bring the non-essential businesses back online. And everybody needs to be doing that in a manner that's safe and with the best thinking and the best practices. So one of the things that I've been working on all along during this crisis is communicating with some of our you know, incredible companies, many of them based in Milwaukee, who have experiences from China and Italy and France, and watching this come across the globe. And that experience means we've learned what's the right way to handle this, what's the right way to handle a workspace, a factory floor, or a retail shop. And by learning that, we can help our businesses be ready to receive their workers and their consumers. And so at WEDC, we are gathering that information, and we will be a hub of resources for businesses who are trying to understand, what do I need to change? Do I need to have PPE? Do I have to put up plexiglass? Like all these questions that are really challenging. But we need to be a resource to help businesses prepare for that and be ready for that. So we are doing that this week. By the end of the week, we should have a list of resources up for the businesses, and we'll continue to push that out and hope that you can help us continue to push that information out to small businesses and to all businesses in Wisconsin, so that we can be sure that as we really reopen our economy, as we really get back into a groove, we're making sure we're doing it with consideration for our neighbors, our communities, and working with everybody together. A lot of what we're doing at WEDC now also is gaining an understanding of the impact of this whole situation on our business community. And we're doing that by gathering data, three levels of data. One is big data, right? Where are we seeing consumer transactions change? Where are we seeing merchant transactions change? And that'll help us inform when we go back in to really put our finger on the scale in places. We're doing it in the right manner, and we're doing it strategically. We're also just hearing about the results of a survey out of UW-Oshkosh, where they surveyed a large number of businesses around the state to understand what they're experiencing, kind of on that mid-level data. You know, what are you seeing? What are your prospects? And obviously the news is really devastating, and we can't hide from it. but we just got to figure out how to work together going forward. The last piece of data that I'm using is I have regional economic development directors all around the state, and I'm looking for anecdotal information from them, not only about, what's the trauma that Main Street, Wisconsin is seeing, but also what are the cool things that are happening? What are the innovative ideas that are happening? Where are the communities coming together and really thinking about how to work together? Because we're seeing some really innovative ideas come forward, and some things that, are almost like, I can't believe we weren't doing that before. So we want to share those innovative ideas out. Many of our small business owners are entrepreneurs, and they're looking to do everything they can to keep their businesses going and functioning. And so we want to understand how they're doing that and help them with that. We're also really, looking for resources for this. So obviously, the federal Small Business Administration loans are coming back online today. That's going to be another effort of resources. We've had good success in Wisconsin. We have, I think, from the first tranche of money, about $8 billion coming into the state to 43,000 businesses, which is an average about $190,000 per business. So that's great. We were successful with that because of the good communication between community banks and credit unions and their folks, their borrowers. So, we have to keep that going. There's fear that this next set of money will dissipate very quickly. So we need to be telling our small businesses, get your application in and get rolling on that. I think a lot of small businesses know that, but it's pretty daunting to work your way through that bureaucratic material. The last thing I want to talk about is really the communication of all of this. And I mentioned it at the outset, but at WEDC, we're basically building what we call a digital stage. And our goal with that is to do our best to get information out in the most accessible form for those folks who need that information. Honestly, this is, I've compared this to just a real almost panic for some business owners. And literally people have kind of forgotten how to read at times, and it's understandable. But we need to be making sure that we're packaging the information in a way that isn't overwhelming, that's really meaningful. And so we're doing that with our digital stage. We're also launching and thinking about launching an effort to talk to the consumers and the workers and the businesses of Wisconsin about what we need to be doing together. Because the reality is we're all in this together. And if you're a customer walking into a business and you're not feeling well that day and you're not wearing a mask, that's not fair to that business. That's not fair to that worker in that business. At the same time, if you're a consumer walking into a business, you should expect that that business has done what needs to be done in order to protect you. You should expect that those employees are wearing PPE. You should expect that there's a cleaning schedule. You should expect that the business is enforcing social distancing. So we have to figure out how to hold each other accountable in a Wisconsin way, in a way that says, you know what, this is what we're all doing together. I know that we know how to take care of our neighbors. We know how to take care of our communities. And just like with any other communicable disease, we have protocols in place, and we do it so that we take care of each other and we're safe for each other. So, it's not necessarily that big a deal to be thinking about your neighbors. We do it really well, and we have to just remind ourselves that that's what our DNA is here in Wisconsin. Our DNA is to take care of each other, and so we'll be able to help work on that. So, I think it's exciting to see this moment start to come where the economy is going to, gain more momentum. And I think at the same time, we all need to keep our eye on public health. So it's a balancing act, and, we can do that, and we can do that well together. So with that, Julia, I'd love to, take a couple questions if you have them.
Sure.
And thanks again for having me here.
Okay, well, thank you very much, Missy. And we do have a couple questions. I want to say too that I think it's great that you're talking about sort of the complexity that it's going to take to restart the state from communications and data, but also supplies and materials. So I think part of the Badger Bounce Back Plan, starting to address that piece about supply chain, is going to be really important to how successful companies can walk that road of reopening.
Yeah. So you reminded me, Julia, of something I wanted to mention. Businesses are looking for PPE and need to know where to find it. And because of our work with the state in the last few weeks, we've established a real understanding of who's producing PPE in Wisconsin. So right now we are building and we'll be launching a list on our Wisconsin supplier network of those companies that you can use to access PPE. Now we know that there's still challenges around N95 and things like that, but this will also be a resource for other kinds of PPE that businesses need and want to be thinking about that they need for their factories or their shops.
That's great. And I think that's going to be an important part of being able to have a successful reopen. We have a question from John Kersey, which is, how are we doing against the benchmark goals or the indicators?
Right. So there's a couple different indicators that we're working on. One is testing. One is number of cases, and another one is standing up our contact isolation, our contact tracing and isolation. So those are kind of the three key tools that we need in order to keep this momentum going. And first on on testing, our goal was 85,000 tests per week. And I know that mid last week, we were looking at about 11,000 a day. So that really gets us, if that's averaged out over the week and we're able to maintain that, that gets us towards that number. And really, again, this is a dialing up and an effort to get towards that. And the reason that we need testing on that scale is because then you can start to identify folks and you can pull them out of the population. And once you pull them out of and isolate them, right, that's that isolation piece. And then you can also do the contact tracing to be able to see who they've been in touch with. And so we can, as Secretary Palm, I just love this term, we can bear hug that case and make sure that, we're restricting the spread of it as best we can. And that's classic epidemic, tactical efforts that public health knows how to do. And so we're working on that. The last one is, and there's other metrics, but these are the ones that I can talk about because I know a little bit, which isn't a whole lot, but the trend of cases. So we did see a spike in cases, I want to say Thursday and Friday compared to where we had been. Those are, I think, associated with a couple outbreaks that we're seeing. And we are managing the data so that, we're not just zigging and zagging with every spike. But it is a challenge when we continue to see numbers increase. And so we have to be thinking like, okay, we feel like we have some momentum, but let's check ourselves. Let's check ourselves with the data and the science and make sure that we actually are comfortable with this. And, as we see outbreaks, I think there was one in Sauk County, some in Grant, like we are seeing this kind of come across the state a little bit more than we had even a week ago. So we need to be conscious of that and watching that.
We've got actually a couple more questions here real quick. One from Jerry Gendusa that's just pointing out that when we do more testing, we will find more cases, and how do we balance that out with that indicator?
Right, and that, that is a challenge, and the data folks in the world are understanding how we manage that, and it's, I believe, on a percentage basis, but you're fortunate enough to have Dr. Raymond here, and he is, an expert in these metrics. So I would ask him that question, and he can probably school me on it a little bit too.
Okay. Well,
my focus is really, honestly, is really on letting the public health folks and the Dr. Raymonds of the world hammer on those metrics, and my job is to get the businesses ready and be talking to the businesses about what they need to do. So I'm really, you can go down so many different conversations. So I'm, as best I can, trying to focus myself on where I can help.
Okay, that makes a lot of sense. We have one question from Sister Andrea Lee from Alverno College. Thank you for your good work on our behalf. Wondering about your thinking related to parents who may be able to come back to work but still don't have access to childcare for their still out of school kids and the many summer activities that are already canceled.
Yeah, I have 3 that are old enough now to take care of themselves almost, they're 18 and 20, so they can practically take care of themselves. But I'm really thankful that I'm not facing that challenge of having to manage, either working from home and having kids at home, or trying to think about going back to work and managing that. Childcare in normal times is a real challenge. And I think in this period of time, it is also a real challenge. And I know that the Department of Children and Family Services is working really hard to make sure, first and foremost, that we have childcare in place for the healthcare workers and the frontline workers. And then, we'll be moving to the essential workers and continuing to think about this. But, this is a good example of things that we're learning, things that we really value, that we maybe didn't have our eye on as much before. I would say childcare, I would say our small businesses and our micro businesses in Wisconsin, and really thinking about, this fabric that keeps our whole economy going is more than just, big industry X or big company X. It is really a very large group, and it has all of these things that tie together. So we're really, the mist is clearing, I think, a bit for all of us on what does it take to really keep the economy going.
Great. And one last question, actually, this is from Elmer Moore, about as you have exponentially increased collaboration with support organizations like the Chambers of Commerce and the WEDC of the world, tell us more how you're going to use organizations like this and scale up to stay connected with small businesses as they're going through the transition.
Well, thank you, Elmer, for that question. It's really interesting because as we came into this whole challenge, one of the things that I realized is this incredible network that we have all around Wisconsin of economic development organizations, chambers, organizations like Elmer's that help all these businesses keep going and provide them advice and thoughtfulness and access to resources, helping them find information. All of those businesses or all of those, nonprofits are really challenged right now because all of their funding is drying up. So as much as we want to be helping every small business, we also need to be thinking about helping that network, because that network is really going to help us get through this. I referenced, how the community banks and the credit unions are helping access SBA. Well, that's also the chambers and many other of these support networks. The tourism bureaus all around the state are really struggling. So we are going to have to also figure out how to resource those because they're critical in this recovery. And I will keep working with them.
Thank you very much, Missy. We really appreciate your time. And I know that you're working 24/7 during this time of crisis. And just want you to know on our behalf how much we appreciate all that you and everybody in Governor Evers' administration is doing to move us through this.
Thanks, Julia. I'm thrilled to have the chance to help Wisconsin. So thank you.
Great. And I think we're handing it over now to Elmer Moore. And Elmer is the president of Scale Up, and he's going to actually moderate the rest of our program.
Thank you so much, Julia. So as Julia mentioned and David mentioned, the future of many sectors will look different due to the COVID-19 pandemic. Today, we will hear from local leaders in different sectors, lending insight into how manufacturing is retooling, how higher education and philanthropy are preparing for post-COVID-19 economies. We have the pleasure of being joined by Dr. John Raymond, President and CEO of the Medical College of Wisconsin, Mr. Dan Sinykin, who I hope I pronounced his name correctly, President of Monterey Mills, Dr. Vicki Martin, President of Milwaukee Area Technical College, and Gina Stilp, Executive Director of the Zilber Family Foundation. And just before we get started with Dr. Raymond, I'd love to just take a second to really celebrate some of the work that our GMC members are doing. For instance, Mr. John Daniels and Jackie Hurd-Barber, along with, we'll include President Lovell, have come together to create an initiative called the 5 Pillars Tutoring. And this initiative, which is really about Milwaukee Fellows, collaborating with the Milwaukee Links, is about securing resources necessary to provide the much needed equipment and resources for MPS kids. This effort launches immediately and will break in classroom and educational instruction triggered by the COVID-19 crisis, and specifically targets elementary school students at the Ralph H. Metcalf School at Milwaukee Public Schools. It's going to serve as many as 350 of those students. So that's just a for instance of some of the activity happening, and I'm really proud to have participated in that. So we're going to go first to Dr. Raymond. It's been 2 weeks since you spoke to us at the last GMC meeting. How is the COVID-19 landscape changing in Wisconsin and specifically in Milwaukee?
Thanks, Elmer. Glad to be here. And I really thank the governor for his willingness to really work in partnership with the business community. If I could go to the next slide, please. Since I began providing updates 4 weeks ago with the MMAC Daily Brief and 2 weeks ago with the GMC, we've been tracking the daily growth rate, the doubling time, and the number of new positive cases of COVID-19 each day. And those metrics have been very useful, and they've shown a positive effect of safer at home and voluntary social distancing intervention with improved doubling times and daily growth rates, and a general trend of flattening of new cases as shown respectively on the left and right-hand sides of the slide. Now, I'm not going to go into detail about these specific metrics, but it's true that we've made great progress. 2 major milestones occurred last week. There was a significant increase in the number of tests being conducted, which is really good news, and the Badger Bounce Back Plan was introduced by our governor. And with the increase in testing, we do expect to see a significant increases in these numbers. And so while these metrics that we've been following to evaluate growth of the virus as we were flattening the curve were valuable, we're not going to be able to focus as much on these metrics in the short term as we begin to anticipate coming down the curve, especially because of the increased number of tests that'll be available. If I could go to the next slide, please. The Badger Bounce Back provides a thoughtful framework to address the twin threats that COVID-19 poses for our health and for the economy. And again, I want to thank Governor Evers for bringing forward this framework and for being willing to take input and to be flexible. Because the Badger Bounce Back Plan introduced new gating criteria and scorecard metrics, going forward, we're going to begin to align regional data with the state's gating criteria. And Wisconsin's Safer at Home extension provides some flexibility, and I would say more so than many of our peer states. But this flexibility does come with some risk, and most of those risks are addressed in the Badger Bounce Back Plan. First of all, we do need more testing. Secondly, we need our public health leaders to have the tools that they need for responsible surveillance and tracing. And we need our employers to be able to protect their employees and consumers so that we don't revert back to crisis standards. And finally, we need mitigation strategies and triggers to impose a higher level of restrictions if the data show that we are not preventing a surge. And finally, we need our citizens to know what it means to live and work responsibly in the midst of the COVID-19 pandemic. If I could go to the next slide, please. With a significant increase in the number of tests at the end of last week, the dialing up that Secretary Hughes mentioned earlier, the number of positive cases per day will grow, as you can see on this slide. Now, positive tests each day are depicted in pink, and the total tests administered are depicted in light blue bars. And as you can see, especially at the state level, we had our 5 highest days of testing capacity last week. But this potentially confounding effect of the increased testing can be minimized by simultaneously tracking the percentage of positive cases as shown in the black lines. Jerry Jandusa did ask about this earlier in the webinar. We plan to begin tracking these data going forward, both for Milwaukee County and for the state. And we do expect the variability in Milwaukee to smooth out as we see the increase in testing take hold in our region. Next slide, please. Now, we've consistently identified shortages of personal protective equipment as limiting factors for treating COVID-19 and for hospitals to resume even a modest level of elective procedures. And although there are serious supply chain issues for PPE, you can see some recent improvement shown by the downward trend of the number of hospitals in our region and in Wisconsin that are experiencing critical shortages of PPE as measured by having 7 days of supplies on hand. that PPE shortages remain a significant challenge for us going forward and likely will remain a limiting factor for the next 12 to 18 months. If I could have the next slide, please. This slide shows ICU COVID-19 hospitalizations since April 12th in southeastern Wisconsin and in the state. And as you can see here, we really have never exceeded the capacity of our healthcare systems to provide intensive care unit care to the sickest of patients, irrespective of whether they have COVID-19 or other reasons for being in the ICU. And I attribute that primarily to our ability to flatten the COVID-19 surge here in the region. So again, we've never exceeded our non-surge capacity for ICU beds. And in fact, the trends are going in the right direction. As you can see, a modest downward trend in ICU bed use. But this is a relevant hospital metric to monitor, but it's not a currently limiting factor, and we'll be following that as we go into the future. If I could have the next and final slide. As we move out of crisis and into our new phase of responsible reopening, our individual and workplace choices do matter. We're going to be living with social distancing for the foreseeable future. I'd like to remind everybody that COVID-19 has a high transmission rate, and for those of you who are interested in R values, it's estimated to be about 4, or about twice what the seasonal influenza would be. And without a vaccine or effective treatment, our only tools are physical distancing, social distancing, wearing face coverings, good hygiene, and other related interventions that rely on personal discipline, personal cooperation. So we're all going to need to work together to overcome the twin threats that COVID-19 poses to our health and to our economy. So with that, I'll turn it back over to Elmer.
Thank you so much, Dr. Raymond. I want to remind all of our viewers that you are invited to post questions in the Q&A box. But I want to start this off with my own question. One of the things that we've heard so much about and read so much about is the likelihood of a recurrence as the weather changes this fall. Can you just give us a few comments about what we should expect there?
I think your guess is as good as mine, Elmer. We don't know that much about this virus, but we do know that coronaviruses in general don't cause a strong immune response. And we also see that the virus now is spreading through the southern hemisphere and that we live in a very connected world. So unless there is a very significant extinguishing of the virus, either by a vaccine or by herd immunity, it's very likely to come back. And so I think, again, when I said we're going to probably all need to get used to social distancing for the next 12 to 18 months until we hopefully have an effective vaccine, it's likely we're going to be living with COVID-19.
Thank you so much for that, Dr. Raymond. You have been an ever-present face in this crisis. You are everything we need in terms of stability, in terms of trust, and in terms of real reliable information and how to navigate this. Really appreciate the time that you've given us today.
Thank you. Thank you.
So our next speaker has an interesting story. Dan Sinykin is the president of Monterey Mills, which is North America's largest textile mill of its kind. Dan, tell us what your experience has been like operating a manufacturing company during the pandemic, and how in a matter of days, you went from manufacturing paint roller fabric and retooled your company to provide healthcare approved PPE masks to hospitals around the nation, all while you yourself had coronavirus. Love to hear from you, Dan.
Thank you, Elmer. I appreciate it. As you said, yes, Monterey Mills is the largest sliver knitting operation in North America. We provide fabric for a variety of applications. Paint roller fabric is primarily 50% of our business, but we supply fabric to a variety of industries, including apparel, hospitals, decubitus hospital pads, blankets, filtration media, and most of the characters walking around Disneyland wear our fur fabric. But 5 weeks ago, we pivoted our manufacturing capabilities to provide a 3-ply textile, washable, reusable safety mask in an answer to the looming and still compelling need for PPE barrier masks. On March 17th, I challenged my management and development teams to develop a PPE face mask with the emphasis on reusability, performance, quality of protection. Because we were hearing and seeing in the news that our country was facing this critical shortage of PPE, and most of the masks being used were less effective disposable cotton masks. We knew we could do better. And as you mentioned, we were facing coronavirus ourselves. My wife and all 4 of my kids were in the midst of a coronavirus battle at that time. We probably contracted it as we went through O'Hare Airport on March 15th, the day after thousands of travelers returned back from Europe per the president's order. Either way, we came at it pretty hard. It was a brutal, probably 10 days for us. And last Friday, my wife and I both tested positive for the coronavirus antibodies and hope to donate plasma this week. But during that time, I knew we could answer the call. We already produce a unique air filtration media that protects workers in factories worldwide. What we needed, however, were 2 things. We needed a cut and sew operation to sew our concepts into usable masks, and we needed to get the word out to first responders, frontline hospitals, doctors, nurses, caregivers that we had an excellent alternative. And this is what we did. We called Eater Flag Company in Milwaukee. We reached out to their president, her team of sewers and designers, and constructed our masks that was safe, washable, and reusable. We called them on March 20th, and over the weekend, we developed the product. We then needed professional reviews by doctors and nurses to see how our prototype would be evaluated and could be improved. We received a unique opportunity from an email from the supply chain program manager, UW Health in Madison. This hospital system needed PPE masks urgently. And on Sunday night, we drove a sample of our masks, still in its earliest version, to Nathan between Madison and Milwaukee. By the next morning, UW Health infectious disease team was evaluating our masks, running it through their usage and wash regimen, which passed with high marks. Nathan placed his first orders within 24 hours. He reached out to Jella Trask from the Wisconsin Economic Development Corporation to make sure that our company was listed as an essential business. That same week, we received press coverage concerning the Eater Flag Monterey Mills collaboration and the donations we made to first responders at the Milwaukee County Health Department, the Milwaukee County Sheriff's Office. We learned that supporting local was a two-way street. Business in Wisconsin started. After UW Health, we received an order from Advocate Aurora, and I can't thank them enough for their initial order and their reorder. Theirs was critical in getting our operation started. Orders followed from Milwaukee VA, Marshfield Clinic, and first responders and public service providers throughout Wisconsin. We're now supplying the Wisconsin National Guard, the City of Madison, Sauk County Department of Health Services, 16th Street Community Health Centers, numerous nursing homes and senior living centers throughout the state. But we're also supplying fabric and masks all around the country. LA County Sheriff's Office, hospitals in New York, and in Ohio and in Texas. We recently added cut and sew capacity needed to supply masks to businesses and individuals. We achieved this capacity by reaching out to Monterey's current customers. We were also contacted by companies we had never heard of wanting to help and keep their factories running. We provided samples of our masks, a sewing manual, qualified them, and added them to our supply chain. Many local businesses have identified the need for PPE already, and we've provided masks to Aaron's Corporation, Exonia Bank, Daniel's Foods in Madison, Seneca Foods, and one of our nation's largest technology companies ordered masks for their 50,000 North American employees. Now we are poised and ready to meet the needs and challenges ahead as our state and nation endeavor to return to work, mindful of the ongoing risk of infection and the need for PPE masks like ours. We started with one cut and sew operation producing 1,000 masks a day, and today we're producing about 65,000 masks a day. Our website, safeusamasks.com, went live last week, and we're committed to donating one mask for every 5 sold for the first 25,000 masks we sell online to families and first responders throughout Milwaukee's most affected area, particularly those in zip codes 53205, 53206. At minimum, we plan on donating 5,000 masks to the community over the next couple of weeks. We hope to partner with the Boys and Girls Club of Greater Milwaukee to help manage our donations. Julia asked me to touch base on some of the processes and procedures we put in place as an essential business during an operating pandemic. We're happy to hear what Missy said, and some of the things she said earlier in the meeting, we're actually putting into place already. We're lucky that our production area has built-in social distancing due to the equipment size and the layout of the factory. But we started staggering breaks and lunches immediately, and we're only allowing one employee per table in our lunchroom. We're cleaning, additionally, the lunchroom over and over again throughout the day, as well as areas throughout the factory where people potentially could touch multiple times. We moved to touchless time clocks and moved to swipe cards instead of manually touching in codes. We provide masks to every employee. We launder them each day and we return them back to their owner in their locker. We take employees' temperatures. We require them to answer health questions at home. We're following all the CDC and DHS guidelines and providing gloves, hand sanitizers, additional cleaning supplies for carts, machines, personal workplaces, and the employees are doing a great job utilizing these. We added communication monitors throughout the factory and provided updated information to reinforce guidelines for safety, health, as well as information regarding the Family First Coronavirus Relief Act. We follow up with every employee who calls in sick, paying employees to stay home if there is a concern. We promoted telehealth to employees, and a number of employees are using it. What's really interesting is we currently have the lowest absenteeism we've had in the last 18 months. The key to all this is communication, phone calls, direct communications. The TV monitors help a lot. Answering questions, sharing information, ensuring employees are getting accurate, timely information about the reliable sources that are made available throughout the state, and providing them a safe environment. I know that I, together with my employees, are grateful we're able to work during these past 6 weeks, providing essential PPE to Wisconsinites and others across the U.S. We hope our masks continue to provide businesses an opportunity to operate in a safe environment with a washable, reusable option. Thank you for your time.
Dan, that is really incredible. 65,000 masks a day. Did I hear that correctly?
Yeah, that's what we're producing today.
Such an inspiring story, and we're just also very grateful for the hard work and innovation that you've shown. You know, just before we transition to Dr. Martin, I would just love to hear from you. One of the things we keep hearing from employers is that their employees are worried and scared. We heard what you developed in terms of safety practices, but how are you dealing with those employees who are concerned that exposing themselves to the rest of the group is dangerous or unsafe?
It's a great question. But I think what the answer is that we've really provided a safe environment. We make sure that everyone does wear PPE. They all wear masks. We do question employees, making sure that we understand what's going on in their homes. And we're asking them not to come in if they're not feeling well or if they've got a family member that's not feeling well. We're continuing to provide a safe environment. They see the cleaning that we're doing throughout the factory, the extra care that we're taking, and making sure that we're communicating and showing the employees how much we care about them and their families, so they know that everyone working around them are coming from a safe environment. We're not allowing employees to work if they're not feeling well or if they're caring for someone that may not be feeling well. We're asking them to stay home. But wearing PPE, wearing masks, and making sure that they have gloves and making sure their area is clean between employees is critical as well.
Dan, that is just incredibly impressive. One of the things I forgot to ask is, did I say your name correctly?
Kind of, it's Sinykin.
Sinykin, great. Well, Dan Sinykin, thank you so very much. I'm glad to hear that you're healthy. I hope your family is as robust and healthy as you are.
Thank you very much. They are.
Presenter is Dr. Vicki Martin, president of MATC. Dr. Martin, higher education is experiencing dramatic changes during this time. What are your plans and projections for MATC and your other higher education partners for this fall semester and even after, looking towards 2021?
Well, good morning, and thank you for having me here today. I just would like to start a little bit with some background about Milwaukee Area Technical College. We are Wisconsin's largest technical college, serving about 35,000 students annually. And among the 16 colleges across the state, we have the highest percentage of students of color, first-generation students. Many are economically disadvantaged. 90% of our students are part-time. Our average age is around 30. And so for these reasons and more, they really do experience COVID-19 more strongly, perhaps than others. But as you can see, it spares no one. And so we really are very concerned about what the future looks like, and we're working hard on it. But what I would like to do is first share some of the headlines that have been out there. And I'll just read a few. FAFSA completion rate is down. And that's the financial aid package for students who desperately need it to pay for their education. The latest headline, though, is that they've actually extended the completion deadline for that. Growing worries about student loan debt, as you can imagine during this time right now. Black and Hispanic students report higher rates of financial hardships. Tuition and fee refunds grow. College presidents expect layoffs, admission trouble. Those are just a few of the headlines. They would take up my whole presentation to really talk about all the headlines we're seeing. But that's what really reflects what's happening in education right now. And if I really look at these headlines and 5 trends that I would like to talk about today that MATC is responding to, these are the major trends that we're seeing. There's certainly more than these, but these are the ones I'm going to focus in on today. So looking at the increasing need for online delivery and other alternative course delivery methods. As you can imagine, the students' changing needs and expectations took us all by surprise, and so they've just exacerbated those needs and expectations. Concerns about the cost of college, and is it a value related to the notion of my student debt is already high, or I don't want to go into student debt right now. There's too many other costs that I need to really cover, including rent and food, and then declining enrollment. Many of us are expecting across the country declining enrollments. Some of our local colleges and universities are not certain whether they're going to have declining or flat or possibly even a slight increase. It's so unknown right now. And employees working remotely who have never done so, and concerns now about when can I return to work, and when I can return to work, what is it going to look like? So let's start with the need for online and alternative delivery. Right now, MATC has moved more than 1,600 classes from face-to-face to an online environment in a very short period of time. Even diesel technician and culinary instructors were able to move portions of their classes to online delivery. And we are still serving over 200 electricity apprentices in a virtual format. We've instituted a pass-fail grading option to students as an option, given what's really happening, and so have many other institutions across the country. We are preparing for safe in-person instruction for those programs that cannot in part or in whole be taught from a distance. Future respiratory therapists, nurses, truck drivers, EMTs, paramedics, police and firefighters, welders, CNC operators, and more need that hands-on learning to graduate and to succeed. With that in mind, we moved 70% of our courses online from the fall of 2020 compared to 12% for last fall of 2019. As one example, we've converted many healthcare lab and clinical components to virtual simulations with realistic patient interactions. And importantly, the tool we are using is endorsed by the National League for Nursing. This work means redefining the role of educator as a virtual online expert. They have developed and strengthened different skills, and we're ensuring that we're doing the same for our students. We've offered online courses for over 20 years, so we certainly have the infrastructure. However, students and instructors have varying levels of exposure to online learning, so we have to continue to provide training and support to make that shift. We are also exploring how to use Milwaukee PBS to deliver education. Many people maybe don't know that we own the licenses for Milwaukee PBS. And so it was originally purchased in the 1950s to deliver education to everyone in the community through TV. And so we are looking and exploring about how we may come back to that. If we go to another slide, the next trend that we're seeing is the changing needs and expectations of our students. First and foremost, we entered this work through the equity lens. COVID-19 pandemic has exacerbated many inequalities for our students. So for us, that means ensuring that we are meeting the needs of all of our students, especially those who are historically disadvantaged. And it means continuing our work to implement our guided pathways framework to help more students of color graduate and to eliminate those equity gaps that exist. So we're beefing up our retention efforts. We've hired more coaches. We've improved our advising system, and we're hiring more advisors. We have wraparound support. We've expanded that, and we've improved our systems to make it easier for students to succeed. And that means more students ready to enter the workforce in those high demand fields or to transfer to a four-year institution. We're proud to say that we have 5 guaranteed transfer agreements with Marquette, UW-Milwaukee, Madison, Green Bay, Parkside, and more. And we are looking at how can we expand that so that students can complete their education and really look at lifelong learning. At the same time, we had heard and we understand that for our students, it means competing demands. They're caring for their family, or they're working, or they have other healthcare issues they may be dealing with. So we launched a mobile app this month to meet student needs for digital interaction. Most of our students we know do have phones. At the same time, we understand the digital divide is real, and we're seeing our students being impacted by it. And the divide has put college access further out of reach for students who lack internet access. To address those health disparities, we partner with Freighter to offer telehealth visits and no copay to our students. So we're very happy about that. And we've leveraged our mental health partnerships to make services available to our students at this difficult time. Surveys of presidents and chancellors across the country, the #1 worry was about the mental health of students and their employees. So we're responding to that as well. We know that students will probably be staying closer to home. So we're partnering with organizations like City Year to offer a promise program to those students that they employ to take a gap year for national service. We're also changing our promise criteria to make sure that more students can take advantage of it, but we know their lives are very complex right now. And so we're going to make sure that the criteria takes that into account. We're also offering a more flexible calendar, which is more important than ever because of the start and stop dates, because we don't know what's going to be happening. It really creates a concern for when students can start and finish. And so we're looking for them to complete sooner. And so we'll have varying start times for them as well. And while we're talking about the changing needs of students, we recognize and take pride in our MATC alum who keep Milwaukee working, our frontline nurses, EMTs, paramedics, medical assistants, and respiratory techs, to name a few. They are in manufacturing, they're running IT networks, they're managing supply chain logistics, driving trucks, and so much more. We also know the cost of college and student debt has been persistent concerns before this pandemic, and it's just growing. And we believe we are well positioned to respond to this challenge with our tuition-free MATC Promise program as the last dollar scholarship for those students who are eligible. And we really have found that since we opened this or started this program in 2015, we've been opening access for students who never thought college was possible. We also are launching a debt scholarship program for our former students who owe $1,500 or less to be able to return to college. We're breaking down those financial barriers that stand between students and their dreams. the same time, we purchased over 1,000 Chromebooks, and we've distributed almost all of them to students who do not have access, especially for those who are taking online courses right now and don't have any way to access that education. But we need to continue to ensure access for our students in the months ahead. And so we're looking at what that means as well. And while Chromebooks break down one barrier, internet access is another. So we're partnering with MPS, Dr. Posley, and UWM, Dr. Money, on an M-Cubed initiative to provide more Wi-Fi access for students. And we're looking at a philanthropic investment of $500,000 that would give approximately 1,000 eligible MPS seniors and qualifying MATC and UWM students internet access to continue their education after high school for a year. And so we're truly looking at breaking down that digital divide and the barriers for students entering the workforce and education. And my contact information is on the slide here if you're interested in partnering on this really important work. In addition, I'd just also like to say that MATC has issued emergency funds in the form of gift cards to grocery stores or rent payments to maintain housing. As you can imagine, we've seen a sharp increase in the requests for additional funds. And finally, MATC submitted its application for the CARES Act, higher education funding, 2 weeks ago. We are required to issue at least 50% directly to students. I need to tell you, we have so many students in need that meet the criteria that we decided to exceed that amount and provide 75% of the funding we're going to get that will go directly to our students to help them. It's not much, it's up to $500 per eligible student, but at least it'll get them some additional help. The next trend is declining enrollment and the funding, of course, that follows. To focus in on critical decisions, we really decided to think about scenario planning. I have to thank my partners in education, Mike Lovell and Mark Money, who have helped us look at what are those models that are out there. So we did look at some models that really help us to make some data-informed scenarios to consider a specific set of uncertainties on what the future might look like and how MATC and other in education might respond to that change and what the future is going to look like. This is a possibility here. We developed our own based on our work streams. We looked at what would the 3 scenarios be for us. And we selected one that really looks at a global slowdown and recession with a medium to high impact, with an effective response, but the virus resurgence and pandemic escalation. We're looking at continuing online learning and so forth. But one of the things that came out of that is that we would develop this nerve center, which is the picture that you're seeing on there. And what that really helps to do is to take those decisions from that scenario and move them forward so that you can, in real time, in 4 to 6 months, really look at what are those key decisions that you need to move everything forward. The other thing I want to mention is that a Simpson Scarborough survey found that nationally about 20% of high school seniors are reconsidering going to college in light of COVID-19, and more are reconsidering where to go to college. So we know that more will stay home. They will be reconsidering whether they're even going to come to college. So we know that we have to look at new markets. And so that's part of that work stream on our scenario planning for the nerve center that we are going to look at. That's just one of many considerations that we need to consider. We also are developing our new strategic planning process. We revamped it completely in light of COVID-19, placing additional value on innovation and agility during this time. And we are also working more closely on virtual recruitment sessions to draw more students in and more dual enrollment opportunities for high school students to earn college credit virtually as well. And finally, the last trend, and I'm sure all of you have experienced this, and maybe many of you had been working remotely before, but we had not. And so we implemented a number of things. I have to tell you, the daily communication, both our students And our employees said that that was very comforting to them. We every single day we sent out a communication, and even if we didn't have a lot to report, we told them what we were working on and what we were going to report on in the next week or so. And we are right now, in fact, today, after I leave this meeting, I'll go into another one to talk about how are we going to plan for a gradual and slow reopening. As you can imagine, many students, especially in healthcare, did not finish up their spring semester. They want to get into the field immediately. And so we have to figure out a safe way for them to do that. That is always on our mind in terms of what do we need to do to make it as safe as possible. And Dr. Raymond and others are very helpful in that regard. Mindfulness, we found that there's a lot of stress around all of this. And so we have done a lot of training around that and making sure that we continue to have a growth mindset. So in closing, I'd like to just say that COVID-19 is changing how MATC and other colleges and universities are adapting and delivering education services. I really believe that we're going to need to reinvent ourselves, and I don't think we're going to be ever going back to the way we were. Our key theme is being innovative, agile, and adaptive with a strong equity framework while effectively responding to the needs of our employers and our community. I think that, as I heard before from Secretary Hughes, by working together, we're going to get stronger together. So thank you very much.
Thank you so much, Dr. Martin. In the interest of time, I'm going to ask that everyone with questions either reach out directly to Dr. Martin or include them in the chat window, and we'll make sure to pass them along. Thank you. Our final presenter is Gina Stilp, Executive Director of Zilber Family Foundation. So Gina, the foundation has pivoted quickly in response to COVID-19. What is the role of philanthropy during the pandemic, and what will it be as we reopen the state and look into the future?
Thank you, Elmer. Thanks for having me. And I think I couldn't have followed a better example of how organizations are having to adapt. Dr. Martin really just described MATC's approach, and it really sums up how organizations are able to change the way they're delivering and their financial models really with no notice. So we have a lot of challenges ahead of us. I want to take just a few moments to go to the next slide and show just a few data points on the need that we're seeing here. 211, which is the central access point for folks in need across the state, began tracking COVID-related calls in early March. And you can see there they've fielded more than 10,000 calls from individuals asking for support that is specifically COVID-related. And on the next slide, you'll see that we've seen a 43% increase in calls for help as compared to last year. Many of those have been around basic needs. So food pantries have seen just wild spikes in demand for their services. There's a lot of fear around rent payment assistance, and then just really the community shelter piece, housing, and medical. So we in the philanthropic sector have really been tracking both those needs trends. And then on the next slide, we can see that the nonprofit organizations that we're serving are also really struggling. Many of them have seen a real severe loss of capital. They rely heavily on volunteers who have been unable to come out and support them due to social distancing requirements or health concerns. A lot of the employees that are on the front lines and work for our nonprofits are in hourly jobs, and they live in the neighborhoods in our city that are most impacted. And so there's extra concern about having to do layoffs or lost wages for those individuals. And as Dr. Martin described, this really abrupt shift to remote work for organizations that are on a shoestring already, who don't have access to technology or the skills they need to do that, that has been a real struggle. We see so many individuals on these front lines going out every day, serving meals, working in shelters, still kind of struggling with that access to PPE. And all of this really, while there's this huge increase in demand. So a lot of our organizations have been asked to do more with less. And it's been very challenging. And I think from the philanthropic sector's response, there's a lot of questions around where can we help with money? Where can we help with other resources? And then how do we make sure that collectively we are sending these culturally competent communications to the folks who are most impacted? So Philanthropy's response, more specifically, across the country, more than 1,000 nonprofits, philanthropic entities have sort of taken this pledge to say, how can we do business better in these new circumstances? And so we want to make sure that we are responding to community needs, that we're immediately deploying resources into some of the emergency funds that we've seen pop up all over the country, including here in Milwaukee. And that we're making it easy on our current grantees. And so eliminating restrictions that we may have had on funding, making sure that everything's available for general operating support so that organizations do have resources to pivot, and making sure that we're listening. I think this is a really important time for us to make sure that those who are most affected and the communities that are most affected have a voice in how resources are being deployed and in what the solutions are. They oftentimes know better than we do. And so we want to make sure too that philanthropy is really being proactive. There's certainly a power dynamic at play between the institutions that hold resources and those that are in need. And so we've taken the approach of over-communicating is better, just being in touch with our partners on the ground and asking what they need on a weekly basis. And the next slide, there's a couple examples I wanted to highlight here in Milwaukee. A ton of credit to United Way and the Greater Milwaukee Foundation. Within, I think, March 13th, we had our first case, and by March 16th, these funds were up and launched. And we have pooled over $2 million from the Milwaukee community into these funds. I think Greater Milwaukee Foundation is quickly approaching deploying over $1 million. And they're operating in tandem. We have the United Way really looking at those emergency shelter needs. They're purchasing food. They're making sure childcare centers have diapers, some of those truly everyday needs. Greater Milwaukee Foundation has been focusing on 5 different issue areas around food, housing and shelter, medical services, mental health, and then education. And so these funds are still both accepting donations from our community and then deploying them really immediately as needs arise. And we wouldn't be able to have a comprehensive response here without the corporate sector as well. And so on the next slide, I can highlight, there's been in the past few weeks just a flurry of activity around an initiative now called Mask Up MKE. And Dan Sinykin, thank you for your presentation earlier. This is another great example of a corporate partner called Rebel converting, really taking what was one of their raw materials. They make industrial wipes, and thinking, how can we use this material we have an abundance of to create something that's supporting our community. And so they quickly started making PPE out of these essentially wipes for hospitals, and started donating them through some of their on-the-ground networks. But as they saw the need increase, they have now pledged to donate 3.5 million of these masks to our community. And what I love about this example is that Rebel knew they had the resources, but that they needed partners to get this work done. So we've brought to bear the Bucks, and they're offering the Pfizer Forum now as a distribution hub. We have foundation partners working to fund some of the costs just to get the masks out. And then we've got nonprofits like Habitat for Humanity, who aren't building houses right now, but can use their trucks and restore workers to make sure that we can get these out to the community. So this has been a really great example of quick response and collective action. And then the Zilber Family Foundation, I want to talk a bit about. We generally have a pretty strategic approach to our philanthropy in Milwaukee around place-based giving in our Zilber Neighborhood Initiative neighborhoods. But we had a meeting in early April and came together with our board and decided that if there ever was a time to do more, now is the time. And so while we continue to fund in our strategic philanthropic areas, our board committed to deploying an additional $3 million in response to COVID. And we will be deploying those in 3 different areas. One, to those pooled funds that I mentioned through United Way or Greater Milwaukee Foundation. The other area where we really feel strongly about is making sure that our current partners, those who are having cash flow constraints right now or increase in demand for services, can get a little cushion. So we'll provide grants of up to $25,000 for organizations we already know and work with. And then an additional pool of funding for basic needs, for public health, and for small business. And I think for us, that's really important. We've always focused on economic development, and there is such an increased need for those small and micro businesses in the neighborhoods that we serve. We want to make sure that we can work through our existing partners to deploy additional resources for those small businesses. And then next slide, one of the challenges in this work right now is there's so much need coming at us from all these nonprofit organizations. Can you go one ahead? Thank you. So what we've seen now is, how do we pivot from this barrage of requests and this emergency response framework to one that is more about recovery for the long term? And so one of the examples I'd like to highlight here, again, a ton of credit to United Way, Greater Milwaukee Foundation, and the city of Milwaukee, very early decided that we needed to start bringing our philanthropic partners together to work collaboratively to have a response that would be inclusive, as well as offering sort of that backbone support. And I think Joanne Anton and Catherine Dunn are on this call. They've put a ton of work into this as well. We've identified 6 issue areas where we feel like the philanthropic sector can play a convening role. And by convening, we mean really how can we prioritize issues, respond quickly, and then bring partners from across sectors together to address these needs. And so initially, we are focusing on food, housing, shelter, physical health, mental health, early childhood, and K-12. So we are on weekly calls really with our partners who are on the ground, and then working as a funding collaborative to make sure we can deploy resources together quickly and efficiently to those who are working day in and day out. And then I think when we look, ahead, we certainly don't know what the future of the nonprofit sector and the philanthropic sector are. But if we go to the next slide, please. We still really do need to think about what does this recovery look like. And so some of the challenges that we are bringing and in conversations that we're having with our sector is really around how can we double down on operational funding for the organizations that we support, whether that's for emergency funding or for other issues that we've all cared deeply about. Let's make it easier for our nonprofit partners to do what they do and give them the space they need to pivot and be creative right now. We want to make sure that we're moving fast and doing that smartly. That means, from my perspective, let's not reinvent the wheel. We have phenomenal organizations who are already working in partnership with one another. We have intermediary organizations where we can pool resources and deploy funds quickly. And we've got economic development agencies like community development financial institutions and some of the others that Missy talked about earlier, where we can pool money with them so they can then work and do the work with businesses who are suffering in our community. We want to make sure we know who's being left out. I think this goes back to that communication piece and making sure that we listen. This is a time to take risks. I mean, there's so many unknowns ahead of us, but we certainly can't sit on the sidelines right now with our resources. We have to get out ahead and invest in those leaders and those ideas that we think will be productive. I think one other point I really would like to make here is on the advocacy piece. One of the benefits of the funding community working together is that we've already been able to identify challenges with the way funding streams are coming in right now. One example would be with food stamps or SNAP funding. We know right now that since the social distancing challenges are real for those who are homebound or who are ill, we're trying to figure out a way to make sure those resources can be used to order online or order through restaurants or Instacart. And so I think bringing these funders to bear helps us think not about necessarily new resources, but how can we adapt the current resources to new conditions. And then lastly, I think, this is challenging because the markets are really suffering and businesses are suffering. But those of us who do have resources, I think the challenge here is for us to do more right now. And so I'd like to sort of leave on that note of now's the time to go bigger, not to be more conservative. I will leave it there.
Thank you so much, Gina. We're going to return back to David to adjourn the meeting. David's coming.
Elmer, thank you very much. First of all, I'd like to thank Governor Evers, Secretary Hughes, and Dr. Raymond for their thought leadership and all they've done to first help us make the decision to quarantine and shut down, and now everything that they're doing to help us determine how fast and when to reopen. This has been clearly a very difficult and challenging process, and I think what we're seeing is reopening might be even more difficult than the decision to shut down, at least in terms of gaining bipartisan support among urban and rural people, Republicans and Democrats. Elmer, thank you for moderating our speakers, and I would like to particularly thank all of our speakers, Gina, Vicki, and Dan, for everything that you're doing to retool your organizations and help the people of the state of Wisconsin. You all run very important institutions, and thank you for sharing what you're doing. The next meeting of the GMC is May 11th. It will again be by Zoom webinar. And in between, the GMC has daily newsletters. We have these bi-weekly Zoom webinars, and then Elmer Moore has been issuing Zoom interviews with sector leaders of our membership. We hope you're finding all of this relevant and helpful. We're doing our best to help you stay informed and in touch. And so with that, again, I'm signing off, and this meeting is adjourned. Thank you.